Okay, so I've already confirmed my medical order and I've compared my 5 rights, and I've already began my first check of the 5 rights, already being time and right medication, which is heparin. Okay, so the next thing that I'm going to do is select the correct needle for the route that we're doing, which is subcutaneous, and that's going to be the 1 milliliter tuberculin syringe with a 25 gauge needle and 5/8 inch long. And so then now I'm going to calculate the dose, which for this vial of heparin, it's 10,000 units per milliliter. So our medical order is to give 5,000 units. So in this case, we're going to be giving a half of a milliliter, or 0.5 milliliters. So the first thing I'm going to do before I draw up the medication is clean the top of it with an alcohol wipe. Okay. And so while that dries, I'm going to go ahead and draw up 0.5 milliliters of air and prepare to inject that into the vial. And now we're going to inject that in. Now we're going to flip it upside down and come over here. And I'm going to draw out a little bit more than 0.5 milliliters, just so I can make sure that there's no air bubbles. Okay. So now at this point, well, actually here. Okay, so at this point I would go and get a secondary nurse to verify my calculations, and then I would perform my second check with the MAR, and then now I'm going to, or then I would proceed to the patient room. Where I would perform hand hygiene. I would identify the patient using 2 identifiers, go over their allergies, go over any pre-administration workups. Then I'm going to perform my third check, perform my third check. I'm going to explain the procedure to the patient, and then raise the bed, lower the side rail, and then now I'm going to go ahead and put on my gloves. For my gloves and my goggles. All right. And so now that I've done that, I'm going to identify the correct location, which is the abdomen for this procedure. I'm going to go ahead and sterilize the area, starting from the inside and moving outward. All right, and I'm going to leave that right there. Okay. And now, when I inject this, I'm going to be going at a 90-degree angle because I have enough subcutaneous tissue. I'm going to pinch the skin, and I'm going to inject the medication slowly so it doesn't irritate the patient. Then I'm going to apply pressure. I'm going to dispose of the needle immediately afterwards. I'm not going to cap it. I'm not going to do anything. And then now I'm going to throw all of my other things away. Okay, that's it.